Hi, I am Eva Pontin, working at the Department of Pediatric, let's see here, Orthopaedic Surgery in Stockholm, Sweden. And I'm going to give you some thoughts after coming into midlife as an orthopedic surgeon. The theme here is how to recruit and keep residents in orthopedic surgeons. So I will give this talk to the residents and also give some hints to the supervisors. So the important thing for a young resident is to find a great workplace where you want to stay. And we know the motive powers for all is to have challenges and to have successes, to be included in the group and to feel joy. So I will tell you some personal reflections and also reflect about some cultural differences I've seen. In the Nordic countries, we have few examinations, either theoretical or practical. There's often an unclear mentor role. No one gets their honor for giving an orthopedic surgeon a successful career. You often have many different mentors. So one has to teach oneself and hopefully be supervised by someone who reflects or mirrors him or herself in the resident. That is, the mentor often wants to see themselves as young in the prodigy or the adept. So if the mentor and resident are very different, the quality of the supervision is not guaranteed. And since the education is not formalized, the supervision is negatively affected if there are no similarities or things that the mentor and the adept could recognize between each other. In Anglo-Saxon countries, where I've been visited, like in Britain or Australia or United States, there's a well-defined tutorship. There are many formalized theoretical tests, and the more formalized training is beneficial for residents who are not the mirror picture of the tutors. For a person, it's very important to belong to a group because we're all social animals and our behavior is greatly influenced by the rest of the herd. Knowing that you belong to a group is crucial for the well-being. So it's important that the workplace has an inclusive approach to all kinds of things like gender, ethnicity, age, tattoos, whatever. Eye color, for example. My daughter, oldest daughter, when she was 15, they had an experiment at school where they said in the classroom, okay, everyone who has blue eyes is inferior. Let's play a game. Everyone who has blue eyes is inferior. And this game they had for only 1 hour, and it ended up with the kids with blue eyes started crying because it's so strong to be excluded, even though everyone knew it was a game. You might have heard about Mia. She's a hip-hop artist, a favorite of my kids. And she has made a very violent video on redheads that were chased and caught and beaten up. And it was so strong that it's actually banned from YouTube. This is in the debate of exclusion out of a group. So she chose redheads for some reason. And that makes it very clear that it's a very strong thing to exclude someone from a group if you're a human being. We all have very many facets, like the gem here. We have our personality, we have our class, ethnicity, religion, gender or sexual preferences, we have our political views, we have our hair color, eye color, height, etc., etc. All those things make ourselves a total person. But if one little facet of you, for example, gender or ethnicity, if that is emphasized, you could feel very alienated from the group. But in the workplace, you could also choose to emphasize on the similarities in the group. For example, that we all wear white clothes, or we all work at the same place, we're all orthopedic surgeons. Discussing gender is very difficult because gender is close to the perception of self. In Swedish we say, könet är nära jaget. So therefore it's extremely difficult to discuss gender, even if it's on an abstract level. So if you discuss that, a frequent perception is that it's the self that is criticized. But the bottom line here is that it's a matter of human rights. You must resist the temptation to lump together colleagues into different groups. It's important you always think the individual. This is an individual. So why did I choose orthopedic surgery? Because it's a concrete and right-on specialty. You get immediate satisfaction from mending a fracture or fixing a hip or whatever. You have endless opportunities to develop expertise and creativity. You will laugh a lot. You see patients of all ages. There's a large scope of diagnosis. And there's also an orthopedic surgeons guild like they had in medieval times that we're like carpenters. We're together and we do this thing, and we have often an apprentice-master relation. And that's very, very nice. And that's a very inclusive culture that we should take well care of. Marie told us some percentages about how many female orthopedic surgeons we've had. When I started medical school in the 70s, there were very few female orthopedic surgeons. These orthopedic surgeons, they were very accustomed to be on their own, lone rangers, I would say. They often had their very small niches, like on treatment of low back pain or feet. In the 80s, the percentages increased to about 3%, I think. The niches became more. For example, the new niche, hand surgery. In the 90s, when most of us started the residency, we were about 6%. And in 2000, about 12% women. And then we now have women represented in all subspecialties in orthopedic surgery in Sweden. So what do I think about the future? Probably we will be 30 to 50% female orthopedic surgeons and 70 to 50% male orthopedic surgeons. And that means that the 30% threshold is passed when a minority group has influential power. And the members of the minority group will then be regarded as individuals, not only the woman, or if we think about other minority groups, perhaps Iranians or other immigrants, you will not be only the Iranian or the homosexual, you are an individual. So at my workplace, where I now work, at the Department of Pediatric Orthopedic Surgery, we are 50% women and 50% men since 10 years. This is quite unusual. And that means that we are you could see that we are so different. The female orthopedic surgeons are very, very different, and also the male orthopedic surgeons. And that means that we cooperate according to personality or interest, not according to gender. So we have no gender groups, having meetings and so forth in our department. But we still have our history, and we must also remember how it was just recently. When I started my residency, old orthopedic colleagues could put female colleagues only into 5 roles from the private sphere. And those are the same roles that were in the old movies. So you just look at old movies and you see what it was like before. You could be the wife, you could be the mistress, the daughter, the mother. The mother could sometimes be a witch, if you remember if you were little, or the mother-in-law, also maybe the witch. So if you're assigned one of those roles, it's very difficult to have a professional relationship. You have to go beyond those roles and to really be able to do surgery together on a professional level, for example. So I'll tell you about my mottos in life, and those are in Swedish, of course, but translated. Livet är långt. Life is long. We all have our professional ups and downs in different phases of life. Some have them early and some have them late. I have 4 kids, so when I started my training, people said, you will never be able to become an orthopedic surgeon because you have kids. But now when I'm older, I can see that some of my male colleagues or female colleagues with our kids have had their downs later in life. You might be sick, you might be, personal crisis, whatever. So it's like, the stairs at Grönelund Amusement Park, where you have the one foot is on one step and the other one at Lustiga huset, Sometimes you never get up, and then you have this, you put your foot on the right stair and then you will end up on the top. And my other motto is, alla har vi våra handikapp. So we all have our faults. Är det inte det ena så är det andra. That's what I think when I meet people. If it's not the one thing, it's the other. So you should forgive thyself and you should forgive others. That's very important in order to work and to look forward. And the other motto is, hur man än gör så är det alltid någon som blir sur. No matter what you do, someone will be disappointed. And I got this from my husband's professor, his dissertation tutor. This man is a biologist. He was a full professor at age 35, 4 children. His wife was a medical doctor. And when his telephone broke down in his office, he had so much junk on his desk that he had to ask his secretary to call his phone, to find the phone. And it was underneath the motor saw. So he had a lot of things to do. So I think about him, and I think you should håll alla lagom sura glada. Keep everyone optimally disappointed or happy. That's also a motto to think. And also, of course, you think you win some and you lose some, and you cannot win them all. So my advice for the young resident is to, of course, choose your parents, first of all, and then choose your boss. Choose your supervisor and be prepared, for example, for surgery, or if you're assisting a surgery, you should, of course, be prepared, and it leads to better learning. And you should seek joy in work. If you do not find joy in work, you might find yourself better off by changing the department. That's better than being unhappy at where you are. Thank you very much.